Hello and welcome. You're about to travel into another dimension. You are about to enter the zone of diabetic complications. Today we will see 3 patients who are suffering the most tragic complication of hyperglycemia due to uncontrolled type 2 diabetes. And then we will discuss hypoglycemia.
Coming through! Stay with me, Susan!
Let the fun begin.
Good morning, Dr. Sterling.
Good morning.
Today we have Susan Skittles. She was admitted for diabetic ketoacidosis. Her blood sugar was 600 on admission. She was breathing deep and rapid, and she was complaining of some dizziness, abdominal pain, and frequent thirst and urination. We took a urinalysis, and she had glucose and ketones in her urine. We believe she's in a state of metabolic acidosis as her pH is 7.25 and her bicarb is 14. We are running D5 half normal saline with 20 milliequivalents of potassium chloride. I also just administered regular insulin drip. The patient stated she's feeling a lot better. She's now alert and oriented ×4, and we are checking her blood sugar regularly.
Okay, thank you. Let's go see the patient.
Hello, Susan Skittles. I'm Dr. Sterling. I heard we had a pretty bad scare. Can you tell me what happened?
Well, I was diagnosed with type 2 diabetes mellitus a few years ago, and I don't really feel any different, so I only take my insulin when I'm feeling sick or I remember to.
Well, diabetes is a disease that does not always show signs and symptoms, but when you don't take insulin, glucose builds up in the bloodstream and can cause many complications that are detrimental to your body. How are you feeling?
Well, I've always had little black spots in my vision, but recently they've gotten bigger.
I saw that you have a history of diabetic retinopathy and coronary artery disease. When's the last time you got your vision checked?
Well, it was probably a few years ago, but I don't understand why my vision would be getting worse.
Glucose loves red blood cells, so when you have increased glucose in the body, the red blood cells get saturated in all the sugar.
Is that bad?
Yes, the red blood cells are normally soft and flexible, but with increased glucose levels, they become hard. Then when they travel to the tiny blood vessels in the back of your eyes, they're like rocks trying to get through a narrow passageway. This can cause damage to the blood vessels and brings excess fluid and pressure to your eyes. This is due to the sorbitol accumulation.
Oh my goodness, is that why my vision's getting worse?
Yes, uncontrolled diabetes is actually the leading cause of blindness.
Blindness? No way!
Well, don't panic. We will set you up with a diabetic consultant to establish an insulin regimen to keep your blood glucose under control and make sure your retinopathy and your CAD are not worsened. Tell me about your diet.
Well, I'm really busy, so I try to eat healthy, but I end up eating fast food a few times a day. Plus, I love my candy. I snuck some in.
Well, with your coronary artery disease, your vessels are hardened, so eating a high-fat diet will further the buildup of plaque in your vessels, worsening the disease process and increases your risk for blood clots and a heart attack.
Oh my goodness, I need to change the way I eat, but I've eaten unhealthy my entire life and I don't know how.
I'll also set you up with a dietitian to educate you on healthier eating habits and to get your complications of diabetes under control. Well, that was a doozy. Next up, my patient recovering from a stroke. Hello, I'm Dr. Sterling. How are you doing today?
Oh my goodness, look at that mustache. You are one handsome doctor.
Can you tell me your name, where you are, and who the president is?
Oh, why yes, I'm pretty sure I'm Cinderella. At my magical castle, of course, and Mickey Mouse is the president.
Actually, you're in the hospital, you're recovering from a stroke, and your name is Mildred MacArthur.
Gosh, are you serious? What's wrong with me?
You're just recovering from a stroke and you have a little bit of memory loss. But don't worry, we'll take great care of you.
Okay, I'm really worried.
Don't worry. I'm just going to go talk to the nurse and I'll be right back.
This patient has had diabetes for 35 years. Her husband recently passed away and now she lives alone. She has a history of hypertension and 45 pack years of smoking. And ever since her husband passed away, she's been in and out of the hospital for uncontrolled diabetes. Unfortunately, this time her uncontrolled hyperglycemia led to a stroke.
Yeah, she seems a little disoriented. How are her lab values? I notice a little bit of edema on her legs.
Well, we believe that she is well on her way to end-stage renal failure. Her GFR has decreased from 40 to 18 since her last visit. We are also giving her a bag of colloids right now because she was so dehydrated when she came in, and she also has protein in her urine.
Mildred MacArthur is suffering from diabetic nephropathy and will soon have to receive dialysis in order to stay alive. We see the decline in the glomerular filtration rate due to her long-standing systemic hypertension, leading to the increase in intraglomerular pressure affecting the kidney's ability to filter. Her stroke is another unfortunate complication of her uncontrolled hyperglycemia, hypertension, and atherosclerosis. With her smoking history and hypertension, she most likely has plaque buildup in her arteries that led to the stroke. In fact, diabetic patients are twice as likely to suffer from a stroke than non-diabetic patients. The day is winding down. Let's go see our last patient.
Hello, Roger Rolling Rock. I'm Dr. Serling. What brought you in today?
Hi, doctor. Well, I've always had numbness and tingling in my right leg, but this morning when my daughter came to visit, she nearly fainted when she noticed the ulcer on the bottom of my foot. She brought me straight here and scolded me the entire drive for not being more responsible at checking my feet, wearing shoes and socks, and avoiding hot and cold temperatures. But I swear I didn't feel a damn thing.
Let's inspect this ulcer. Your ulcer appears to be golf ball shaped. There is some drainage and it has defined borders, but it also appears to look at the start of gangrene. Do you know what caused this?
Yeah, my daughter never lets me forget that I have developed peripheral vascular disease due to being lazy and my poor management of my diabetes. Sorry, I like my cigarettes, beer, and steak, but you try having one leg being a World War II vet whose only friend is a dog.
Well, I'm sorry to tell you, Roger, but your daughter is right about managing your skin better. You should be inspecting your skin, applying lotion, and avoiding extreme temperatures every single day. The numbness and tingling you mentioned earlier is called neuropathic pain, and that affects your ability to feel in your lower extremities, caused by your uncontrolled hyperglycemia. With this kind of ulcer, we will do our best to prevent osteomyelitis, but it looks to me it's already too late and the infection has spread to your bone. If you had managed your diabetes by taking your insulin and eating healthier, there would not be an abundance of glucose for the bacteria to thrive on, and your risk for infection would not be so high. Now, moving forward, let's get this disease under control so it does not start to affect your autonomic nervous system and cause you to lose control of your bladder and you begin to develop heart abnormalities. I don't want any of that for you or for you to lose your other leg. But no!
Wow, today was hectic. All three of my patients were suffering from type 2 diabetes mellitus, suffering from micro and macrovascular complications due to their uncontrolled hyperglycemia. We've talked so much about hyperglycemia. Let's move on to hypoglycemia.
It is important to be aware that people most at risk for developing hypoglycemia are those with rapidly fluctuating blood glucose levels, taking exogenous insulin, and those taking oral sulfonylureas medications. Also, common signs and symptoms of hypoglycemia are being cold and clammy, shaking, irritability, confusion, seizures, and rapid heart rate.
When a patient presents to us in the hospital with hypoglycemia, we need to treat it quickly because it's life-threatening. We should give them 15 grams simple sugar or carbs, such as 4 ounces of orange juice, glucose tablets, or a tablespoon of honey in order to increase their glucose. We will check their glucose levels every 15 minutes after until they return to normal range.
Type 2 diabetes rates have increased and continue to increase. As future nurses, we need to recognize and be aware of the complications, but also educate our patients on health promotion, such as encouraging visual screenings, educating on proper skincare, healthy diets, and the importance of sticking to insulin regimens and checking blood glucose regularly. Be the patient's advocate and get their families or support systems involved.